Hey everyone, back here again, VCS 2017 in Las Vegas. This time I'm joined by Dr. Alex. Thanks for joining us.
Oh, my pleasure. Thank you for having me, Drew.
How's the show going so far for you?
It's good. It's actually my first time here, and I've
Really?
enjoyed it. Yes, sir. They had a lot of good educational sessions. I learned a lot about treatments that I do, the injectables, the fillers, lasers, and a lot of practice management as well.
Okay, cool. What was one of your favorite sessions?
Well, I just came back from a session that just ended on reputation management.
Beautiful.
And they were talking about online reviews and
Sure.
making sure how to get good reviews and how to address negative reviews.
Okay, cool. Good
Yeah.
stuff. That's really important, right?
It's very important, and it's something you don't really learn.
Yeah, cool. So this is your first year at VCS. How would you compare this conference to all the other ones? Because I've seen you at a lot of conferences.
Been to the other conferences. I feel like the VCS has a slightly different target audience. Specifically, the audience here are core physicians, plastic surgery, dermatology, things like that. And most of the attendees, I feel, are physicians.
Yep.
Rather than some of the other ones where there are a lot of non-physicians. Not that that's a bad thing, but
Yeah.
the sessions are designed towards that, so you get a different educational experience, which
Cool.
is good.
Yeah, absolutely. I love it. That's what everybody's been talking about so far, is the multi-specialty and getting to work with those different colleagues that you wouldn't normally be able to work with.
That's very nice.
Cool. Let's shift gears here a little bit. I just want to ask you some fun personal questions and
Yes,
get
sir.
to know you a little more. What's your favorite color?
Color, when I was young, I guess my favorite colors were green and purple, but
Okay.
now...
Purple's my favorite color.
You like purple?
Yeah.
Yeah.
Now, what would you say now? Has it changed? Or?
No, I don't think about it.
You'd be surprised how many people actually don't think about their favorite color. Maybe
Yeah.
that's something you don't think about when you
Yeah.
get older. I don't really think about it either, I guess. But anyways, do you like sports?
I like sports. I enjoy basketball.
Okay.
I used to play. Now I'm too busy. I need to get back in shape, but I enjoy watching it.
What's your favorite sport team or basketball team?
Well, I'm from
Professional.
Los Angeles, so I
Yeah.
was always a Lakers fan. They haven't been doing well
Right.
recently, but when I was growing up, they were a dynasty.
Yeah, of course. And I think we're going to get back.
I hope so.
Yeah. What was the last thing you watched on TV?
I don't remember. I don't watch a lot of TV. Sometimes I'll watch sports or
Yeah.
the news, but I was actually at a session this morning by Dr. Paul Nassif, who's on the show Botched.
Yeah.
And I watched that with my wife.
Okay, cool.
And
That's
it's
a
a
good
lot
one.
of fun. Have you seen that show?
Oh, yeah, absolutely.
Yeah, so he was talking about some of his experiences,
Okay.
which is he's very entertaining. The show is great.
Yeah, absolutely. Good stuff. Why did you become a plastic surgeon?
So my background's actually in dermatology, but
Okay.
they're often very similar. I find that the lifestyle is very good. You get to make patients happy. The patients are generally happy overall. You're helping them. They're not dying. You don't have to deal with emergencies.
Sure.
So it's kind of good overall, and it's a mix between a surgical and a medical subspecialty in that you are able to treat them both in the consultation and recommendations, but also with procedures.
Right, cool. What's your favorite part of the job?
My favorite part of my job is looking at before and after pictures with my patients and seeing the look on their face when they
Like
get
their before and afters?
Exactly.
Seeing the look on their face from the transformation?
Exactly.
It's got to be a good feeling.
It is, and it's really I'm happy for them because they trust me to help them, and then when they see that we've accomplished their goals,
Yeah.
that's a good feeling.
Cool. All right, last question. If you could be any kind of animal, what animal would you be?
Oh, I don't know. You have a lot of these. There are a lot of these questions. I don't know. Maybe I'll say a dog because
Yeah.
it's man's best friend.
Yeah.
We
absolutely.
recently lost our dog.
Oh, man.
Yeah.
I'm sorry to hear
but
that.
thank you. He was old.
Yeah.
He was old, but that's how it is.
Are you guys going to think about getting another one eventually?
Maybe later. Maybe we have a son now. He's 2 years old. So
Okay, you gotta
we're
raise that
working
dog.
on that. Yeah, that takes a lot of work.
Yeah.
They live longer.
Okay. Cool. Well, thanks for joining us, Dr.
I
Axe. I really appreciate
My
it.
pleasure. Thank you for having me.
Yeah, you're welcome. Have a good rest of your show.
Thank you, sir. Good to see you.
You got it.
Ooh.